Hi, my name is Dr. Jason Mavor. I'm the chiropractor at Mavor Chiropractic in Watertown, Massachusetts. Okay, so for the next exercise, I'm going to show you an exercise that can kind of help strengthen these inner thigh muscles. They're called the adductors. A lot of times when we exercise and we do things, particularly if you notice when you're doing certain exercises and your legs want to turn out, or if you have a lot of inner thigh pain, inner hip pain, these muscles are periodically not doing their job. And there's a couple ways to do it, but it's a very simple way that we can do that will actually work both sides of the hip. And really all you need is a nice big squishy pillow. Now if you go to the gym, you can take an exercise ball, but you want something with some give, enough so that there's resistance so you can work it. You can also take something like an exercise band if you're feeling motivated, but for our purposes, we're just going to use this pillow. So basically all you do is you either lay on the floor or in your bed, make sure your head and neck are supported. Your knees are going to be bent at this 90-degree sort of clamshell kind of position here. I put that pillow right between my thighs, closer to my knees, and what I'm going to do is just squeeze and hold. Squeeze and hold. Now, if you don't have one side that's bothering more than another, you might roll over and do the other side, but generally I find that usually people with sort of hip, groin issues have one side that's more problematic. So I would recommend they do this maybe 15 to 20 times, a couple times a day. Now the pressure you apply is really up to you. You don't really need a lot. I'm not pushing very hard because we're not trying to strengthen these muscles. We're trying to engage them so they start working a little bit more efficiently. Rather than stretching them and trying to do that, loosen them, I'm actually trying to fire them to get them a little more responsive so they maybe do the work they're supposed to rather than sleeping on the job. Now, that being said, if you're doing this exercise and it provokes a deep pain or a tearing or any kind of sensation that feels unusual or unpleasant, stop. Stop right away. Give us a call. We'll evaluate to make sure there's nothing more severe going on. If there is, we'll treat it accordingly. Otherwise, please feel free to contact an orthopedist or an exercise specialist. Make sure they can, physical therapist, someone like that, so they can evaluate your hip, groin, and make sure there's nothing more severe going on. Otherwise, once in the morning, once in the night for about 20 repetitions. If it's both sides you're working on, then you flip over and do the other side. It's nice to do this in bed because that's where pillows tend to live, but you can also do it with couch cushions or something like that in your living room. Anywhere is fine. Just make sure, again, that when you're on your side, you have something under here so you're not straining your neck or your shoulders because this is a focus on inner thigh hip muscles.